My name is Shelley and I'm a nurse at Centers for Gastroenterology. I'm also the supervisor of the nursing staff, so sometimes that's difficult.
So you manage everyone's schedule?
Yes, and assign tasks and reprimand people when needed, and that's not.
Yeah. And do you truly enjoy your day-to-day work?
I do enjoy the nursing part of my job.
Can you describe where you work in as much detail as possible?
There's 13 physicians, 2 of them are women, the rest are men, and there is about 50 employees in the office, altogether between the nursing staff and the medical records department, the call center, the front desk. There's 2 men that are in the office daily. That's the practice manager and the IT man.
Can you describe a typical day and what activities you partake in?
So if my physician is in office that day, I check room patients and bring them back into the office, get the patient ready to see the physician, and enter all their information into their chart in the computer. And then when the doctor comes back out, gives me what he's going to do, I enter their prescriptions, making patient phone calls, giving them their test results, and taking patient calls that come in if they're having issues, and talking to them about any problems they're having.
Who are your coworkers and what activities do they do?
My coworkers are actually, there's a lot of them because there's the other nursing staff, so there's nurses there, plus there's medical assistants.
Okay.
There's also, I work every day with the girls at the front desk because they're constantly calling me, asking me, if I can speak with the patient or get a patient into seen sooner, or are their symptoms severe that they need to be seen right away, or should they go to the ER? Working with physicians every day, not only the physicians in our office, but I talk with physicians that are calling in, either trying to get one of their patients in.
Are most of those people men, would you say?
Men, yes. Okay. Or I do work with the IT man a lot because we always have a lot of computer issues going on that affects the way the staff I supervise, if they can get their job done or not. And the patients too. I see the patients, and it's a lot of people. Yes. So most of the physicians are men that I deal with, but then all the staff is mostly women. It's harder to deal with women because I think women put a lot of emotions into things. Men deal with things very differently. They're very much face-to-face. They'll just go to the person and say, this is the problem, and sometimes argue it out or come to a conclusion. Women tend to want to talk behind each other's back, and little things grow and become big, and so it makes things difficult. Everyone thinks of each other as a friend usually when you're working together, and then when I was promoted to a supervisor position, they get a little intimidated by that, and then they don't know if are you their friend still, or are you looking out for the company?
Do you know of any male nurses and the activities that they do that are different than women, possibly?
I do know in our Loveland office we have a male nurse, and he's just different. There's not a difference between the care they provide the patients. I think the care's good whether you're a woman or a man. I see it more of a problem in their relationships with their coworkers. And a lot of our patients, the 2 women physicians that work for us, their schedules are booked out about 6 months ahead of time because so many, a lot of women want to see women. They don't want to go in and see a male doctor. Or, some women may not feel comfortable with our male nurse. Sometimes I run into that with male patients too, but sometimes they just won't tell me and they'll say, I'll talk to the doctor. And I think that's maybe because I'm a woman and they don't feel comfortable telling me their very personal health issues. Or vice versa, the female when they're with the male nurse. I don't think it has been too much of a problem because we don't really push it. Then we just let the doctor know we weren't able to get that information from the patient because they were uncomfortable.